It's been 4 days since we learned that a single staff member at the Hawthorn Park retirement community tested positive to COVID-19. In the days ahead, as test results come back, we're expected to learn whether or not it spread to other staff members or residents at Hawthorn Park. But as for how this individual, this initial staff person, picked up COVID-19 in the first place, the public may never learn. This is just one of the topics we bring up with the CEO of Interior Health, Susan Brown.
When anybody is considered positive in a long-term care facility, it is considered an outbreak, whether that's just one person. So immediately contact tracing goes into play, as you've highlighted, and anybody with any types of symptoms would also be self-isolating. And then we go into checks and auditing, making sure the protective equipment is being used right, housekeeping is being done to the highest standard, and just assisting that particular facility with anything else they need just from a supportive role.
Is there anything that you can tell us at this point about, how that's gone in terms of testing, other contacts that this person had?
Obviously, when you're working in a long-term care facility, there will be contacts of some nature, so everybody's been followed up with, and we're in a waiting period right now, because obviously if they've been tested, just waiting on results, and then how they do, because sometimes symptoms can take a few days to show up.
So once the test results come back, is that the kind of thing that the public will hear about, whether or not the situation has worsened or grown?
Oh, definitely. And I think we had, one other instance in Cranbrook when we had a long-term care facility that had one positive person, and we have been managing that very well. And to date, we're 13 days later, and there's no other cases. So hopefully tomorrow that will be declared over, and it would have just been one person. So I think our medical health officers and our public health team are doing an outstanding job of getting on the contact tracing immediately and making sure we take things to the most extreme that we can around putting people off work if they need to be off work, and anybody with symptoms is followed up appropriately.
When something like that happens, the first question, or one of the first questions in discussions people bring up is, well, how did this person get it? Will we ever hear whether or not this individual had been traveling, or whether they just picked it up circulating in this community?
The actual contact tracing and how somebody, if it's linked to another case, is something obviously the medical health officers want to know and need to know. So not something we'll be sharing publicly, but definitely they will understand that linkage between cases for sure.
We've also heard recently that there's an increase in available testing. What are the circumstances in which someone should be seeking testing if they think maybe they came into contact with somebody and have no symptoms, or if they maybe have symptoms? Could you just run through under what circumstances they should be contacting their physician or in some other way seeking a test?
Yeah, so recently you'll have heard that the testing guidelines have actually changed in British Columbia. So one of the best sources to go to is the British Columbia Centre for Disease Control's website. They actually have a self-assessment test, and their website is very up to date and tells you all the things you should be considering when you're looking to see if you need a test or not. And if you're symptomatic and if you're in any kind of doubt, you can contact your primary care provider or contact one of our urgent and primary care centres. And there is actually 14 different areas across Interior Health you can get testing done.
I know that at places like Kelowna General Hospital that there was speedy work done to kind of clear the decks for the possibility of a surge of cases coming in. I guess because we've done so well at flattening the curve, there really hasn't been much of a surge, I understand, and so now there's talk about getting some of those elective surgeries to come into the hospital. When can that start happening? Why not right away?
Yeah, so just coming back to your first statement, British Columbia did an amazing job of preparing for the worst case scenario, which is what we did collectively. The decision to stop elective surgeries and procedures was obviously a very difficult one, because obviously we don't want people suffering at home in pain or different things. So, but it did, as you say, allow us to reduce activity within our hospitals and be ready for a surge if we got one. So that put us in a very different state than other countries have been. For example, like Italy, where their hospitals were at 110% when this started. So being able to absorb cases when you're at that kind of peak is very difficult. So now, as you say, we've had some flattening of managing, not completely flattened. There still is an increase in some cases, so still the need to be cautious, but there is discussion about elective surgeries, but it will be most likely in a phased type of approach, so we're just waiting to hear what that will look like.
So how soon might we hear people, getting the call, yes, you can come in and have this surgery or that? What sort of time frame are we looking at?
I would expect in the next few weeks we'll hear something. It will probably be announced, as we've seen every day. Our provincial medical health officer and our Minister of Health, Minister Dix, they do a great job of informing the public daily to the best of their ability of what's happening.
When the pandemic kind of took hold worldwide, a lot of non-essential businesses made their own decision to shut down. And now there is given everything we've just talked about, some people are saying, some businesses are now considering, and some already have, reopening. What sort of things should they be considering when they make that choice?
Yes, and I think there's some businesses that just do not lend themselves to reopening at this point in time. Places that you have to be in close contact with people, like personal services, like spas, things like that, it would be very difficult to stay social distancing and be that way that all the great parameters that we know we have to keep doing for the future. So other businesses in Kelowna, I'll speak to that because they're the ones I see. They've done a great job, actually. I see outside of stores, they've got the 2-meter lines in between people and limiting the amount of people in a store at a time. Some, if you, for example, in the grocery stores, you see them sometimes handing out a wipe. You can wipe the handles of your grocery cart. So they've done a great job at trying to maintain that social distancing and cleanliness and just making sure everybody's safe inside the store and the workers. So I think stores that have the ability to do all of that, and if it's a smaller store, I see some people letting one person in at a time. I see a lot of our stores have gone to much more online business, which seems to be working for some of them. So I think it will be a mix, and it will depend the physical environment and the amount of staff they have, and if they can keep everybody safe, including themselves.
Right, yeah, I'm thinking about those stores that just sell things, of some kind, selling their widgets. If they can do it in such a way where they are employing these strategies to keep customers separate from each other and separate from the people they're dealing with at the store, then you would have no disagreement.
I think we'll have to be cautious, though. The worst case scenario for this province is that we have a big surge, or we see a comeback of bigger numbers, because I think if that scenario happens, then more stringent parameters will need to be put in place. And I think if we can make sure that we hold the line for a bit longer, hopefully we'll be in a situation that, excuse me, we'll be more back to a new norm of life. But if we go too fast and we don't see the flattening continue, then obviously we'll have to get stricter again. And I think you've seen this in places in the United States.
Yeah, so I think the natural course of things is that some businesses are kind of creeping back in cautiously. Maybe that's the best way to do it. And if everyone was to just suddenly say, yeah, non-essentials, let's all, open at once, that might be a bad thing.
Absolutely, and you've seen it in other jurisdictions where that's happened, or where they haven't shut it down fast enough, where they've had big transmission of cases, large amounts, and then increased deaths. So that is the last thing we want to see in British Columbia after the amazing work that everybody's done. And I think for the most part, the public have been very respectful of the recommendations and seem to be doing that well. I know it's a big sacrifice for people.
What about PPE supply? Do the healthcare workers here, are they still having to reuse PPE that ordinarily they would have just used once? I know there was some of those pressures on some of your staff people here. What's the supply like now?
So to date, all our staff are using personal protective equipment like they would. It's available to them. The province has gone to a next step of reprocessing N95 masks. So this is N95 masks. There's different standards of that. The ones in healthcare are a bit unique. So there is a sterilization process that we can go through that allows us to use it again, just one time more, and the manufacturer has signed off on that, as is Health Canada. So that is safe for staff to do, and that's the only piece of equipment that's being reprocessed at this point in time.
Right. So you took on this role a year and a half ago, and not knowing that, within that time frame that the sort of healthcare crisis of the century would hit. How have you sort of personally gone through this?
I've been in healthcare a long time in 2 countries, so all of that helps prepare you. I went through SARS, H1N1, a lot of different things. So you learn from different leaders, and we have a fantastic team here. Our senior leadership team is amazing. Our staff have done an outstanding job. I couldn't be more proud.
Thanks very much for your time.
You're very welcome.